And so we're going to get in here and talk about food and nutrition, the things you should or should not eat for IBD. We're going to be talking about all kinds of different diets, going over some examples. This is really important stuff. So what I'm going to do here is actually share my screen, getting into food and nutrition, how food and nutrition affects IBD and what you should eat. There are a lot of different things surrounding this, different food types, different diet types. I have like 20 different diet types written down. We're going to go over these and talk about them. And remember, if you have any questions at all, please do ask. I want to make sure you guys have a chance to get the information. But before we get into this too far, I really want to hound something into your brains. I really need you guys to remember this one. Diets and programs aren't simple. I often get asked, well, what should I eat, or what should I take, or what's the one thing I should do? And it's never that simple. And I'll explain with a little analogy later on in today's talk about why that is. But something to keep in mind, programs aren't simple. No two bodies are the same, okay? Everyone's got different conditions, different type of colitis, proctitis, pancolitis, Crohn's, different types of strains and stressors. Some people are like a 1 on the Mayo score. Some are a 9 in severity on the Mayo score. So everyone's going to be different. There are genetic factors and predisposing factors. There's genetics that play a role in your liver function, that play a role in where you're going to get inflammation, whether it's in your joints, you're getting anxiety or hair loss or hormonal issues, all kinds of stuff. Everyone's immune system is going to be different. Even though we say it's always autoimmune, it doesn't always prove to be always autoimmune, but we can see different types and styles of immune responses. And so you want to make sure that everyone's immune system is going to be balanced out and balancing itself properly. Because someone asked the other day, we talked about supplements, we're talking about glutamine. And if I just give glutamine to every person trying to repair their gut, if someone has a different immune response going on right now, person A has a different one than person B, and I give glutamine to A and to B, B could have a horrible reaction and their symptoms could get 12 times worse. We want to be very careful about that. And so it's very, very important that we do these things properly and understand why we're giving what we're giving and take these into consideration. Another one's going to be bacterial imbalances. Bacteria is really big because bacteria, our microbes, are roughly 1 to 3% of our entire body. Okay, so I'm 200 pounds. That means I've got 2 to 6 pounds of microbes, just bacteria living in my body. Okay, 1 to 3%. And so we have to take these into consideration, what they're doing, when they're in balance, when they're out of balance, what they look like, blah, blah, blah. And so I get asked again, what can I take? I can't tell you guys one specific thing you should take. We can try to give you as much information as possible to make good informed decisions. Okay, food tolerances, most of you guys know these already. You've taken different food tests, food sensitivity tests. You take your own foods into account. You keep food journals. You know what you can and can't tolerate. Okay, blood labs matter because blood labs are going to be different from person to person, again, showing different hormonal responses, different liver function, different toxic loads, different types of immune responses we can see. We're going to see different functions in hormones and all kinds of chemicals and sex hormones and thyroid hormones and all these things that matter. We have to consider these factors as well. Okay, medication is a big one. Different medications people are on, different biologics, different immune suppressants, different types of steroids, different types of anti-inflammatories, be them oral, be them suppositories, be them injectables. There are so many different kinds. If you're on IV drips, they all play a different role in the body and act differently. Therefore, we create a program that has to be different. Okay, dietary history, of course, what you've tried, what you've not tried, foods you're on, not eating, etc. Okay, so lots to consider here, guys. And we're going to dive into more details about the foods. But while we're going into this one, I just want to avoid the questions that are, what food should I eat? I can give you some recommendations that we'll go over, I call generally considered safe, but I can't say here's exactly what you should eat. But I'm going to give you as much information as I can to make good choices. Okay. So this is the same thing we see with supplements and why I wanted to bring it back full circle. We often say, what supplement can I take? And that's a bad way to go about it because like we explained, there's no one simple answer. And the what supplement can I take response doesn't help us get to the root causes of things. Okay, what supplements can I take don't give us real answers. And so we need to say, how can I correct my systems? There's much, much, much more to it. And I'm going to explain that again here in a minute. But this is the same thing for our food. Meal plans are different. Everybody's body is different. Every body is different. We talked about immune and hormones and all kinds of different systems. We talk about tolerances, imbalances, hormones, medications, medical history, any kind of medical or surgical history, interventions, all the contributing factors that we talked about in day 2. All those things play a role. And so we're dealing with different types of food. These are just some basics. This is just a quick list I pulled off my head. I have a long list here. I see you here, Jocelyn, Louise, Amanda, Morgan. See you guys here. Appreciate you checking in. So some of these variables, guys, high FODMAP, low FODMAP. Most of the time, people typically try low FODMAP. Sometimes I go high FODMAP. It depends on the individual, and it can work out really well. Fiber, sometimes we go high fiber or low fiber. I've got some people with really huge bacterial overgrowths and imbalances who need low fiber so their bacteria don't feed on that fiber. Some people need high fiber because their bacteria looks really good. They actually just need more clearance and detoxification through the system, more bulk in the stool, more whatever. Maybe they got to scratch out some of those plaques. So we go high fiber. Some people need more calories than others. This isn't just weight gain, weight loss. We talk about calories in the world of IBD. Just to detoxify the system, sometimes we need a higher amount of carbs or a lower amount of carbs, depends on what's going on with the body. A lot of women typically can use more carbs, but if you're getting sick or killing bacteria or flooding your system, maybe we got to change it up and go lower carb, right? Protein. Some people don't do well with high protein. Sometimes, rarely is it low protein, but oftentimes it's a medium protein. And so maybe half gram per body or per pound of body weight, depends on the individual. Okay. Fats. Some people, I'll give them lots of fat, keto or carnivore, something like that. And what we'll see, if they feel really, really good, the bacteria starts to balance great. If they're getting floaty, oily stools, if they're getting really greasy stools, they're not digesting that bacteria. And we can start to see that now flooding the system. And we can see their body sort of rebelling. And we can see that causing liver backup and liver issues. Now we got to create a whole liver flush and protocol phase, take care of the livers and the lymph for a couple of weeks. And then we can dive into the gut stuff. So it's very, very different. Obviously, allergies and sensitivities we want to watch for. Oxalates. Some people have trouble with oxalates, both digestion, processing can cause stones and kidney stones. Now, micronutrients are important. We talk about vitamins and minerals in water. If this gets overwhelming or you guys have questions, just drop them in. I have 2 different screens here so I can see the comments on both so I won't miss you guys. I can see who's tuning in. I can see the comments. So make sure you ask questions. Don't ask them too late because we might miss the topic, okay? So micronutrients are going to be your vitamins, minerals, and waters. Sometimes people are very depleted. Now, most people with IBD can do really well with basic electrolytes. That can be very, very helpful, okay? But we have to watch some other stuff. I got a client right now with a magnesium sensitivity. So we have to go back into the system, see what's causing it. Was it type of magnesium? We have to rip these things apart. Okay, we have to look at digestive capacity. Some people, when they're going for a food plan, they want a meal plan, they just try one that's recommended by a doctor who don't study nutrition, by the way. They go off the internet, they go into a Facebook group and just ask for suggestions, say, what can I take? And so those are problems for people as well. And so digestive capacity, it's how much can you take? How much can you take on? Should you take on more or less? If you're not digesting very well and you have slow enzyme production, low stomach acid production, slow movement of food through the system, you might have a low digestive capacity. We have to account for that, okay? Organ systems and function. We'll talk about this one a bit later here as well. I almost said a bit liver, clearly an important organ. And so organ systems and function, how are they communicating with each other? Which systems, which organs within your digestive systems or your hormonal systems, which are contributing to IBD, which systems have been damaged? Oftentimes what happens is maybe you have a bacterial issue that happens in the gut. And because of that bacteria, it causes high stress in the body. And those inflammatory markers start to slow down the liver. And with that, it causes more toxicity and the stress. And we start to develop anxiety and mood disorders. And then we start to get that going on. Then we start to deplete our stomach acid and our peristalsis slows down. And then we start to have bacterial changes and build up that now compound onto your original bacteria imbalances. Now we have issues into the skin and we're getting irritable. We got mood swings. Now we're on antidepressants. Now that we're high stress, now we've got hormonal issues. So the doctor puts you on birth control or puts you on testosterone injections. And all these things start to compound. It turns itself into a bit of a pretzel. And we have to be able to unwind this pretzel, okay? I got a question here from Wayne. Are there any safe snacks that would include sugar, salt? Salt, sure. I'm a big fan of salt. Most people should salt their stuff as long as it's proper salt, pink salt, sea salt, whatever, not table salt. That's sodium chloride. The iodized table salt is terrible. Sugar, no, that's never going to be a good thing. Okay, so lots of things to focus on here, guys. Liver capacity. Your liver is one of the most important digestive organs in the body. has over 2,000 different functions. Used to say it was 500. Now they're estimating about 2,000 different chemical functions in the body that your liver will perform. And so we have to make sure your liver is processing properly. Now, if we go to the doctor and they take your blood labs, go, well, your liver enzymes are fine, you're good. It doesn't mean you're good. Most of us probably need some liver love. Most of us, if not all humans, most people, especially with GI deficiencies, are going to need some liver love. So we have to take care of that as well. Toxic load. Medications are toxic. Bacteria is toxic. Inflammation is toxic. Stress is toxic. Foods are full of toxins, sugars, pesticides, all kinds of stuff are problems. And so we have to make sure we have an adequate toxic load. Like we talked about the other day, when we're creating food plans, you mentioned this in supplements. If we just go in and someone comes in with huge bacterial overgrowth and they decide, well, I got to bring this down, I'm going to start killing it all off. That toxic load can flood your system. You can get the flu-like symptoms, muscle joint aches. You can get migraine headaches and permanent liver and kidney damage and all kinds of stuff. That's that Herxheimer reaction we talked about. We have to be very careful about that, okay? And each person's going to have a different goal. Is it just to make sure I can just poop 10 times a day instead of 30, or do I want to have my life back and reverse it entirely? Depending on how serious you are about that goal, depends on the interventions that you're willing to take on, right? So more things, health status, how food stacks with supplements, all those different things are going to matter, change absorption, usability, etc. So here are a couple of different diet types that I consider when I'm looking at somebody with IBD. And I don't mean this to overwhelm you, but I want you guys to understand it's not as simple as here's one diet type. So carnivore might be good for somebody who's got huge bacterial overgrowth. Low FODMAP might be good for most people, but again, some people respond better to high FODMAP foods, depending on what's going on, if we're in a clearance phase or detoxing or whatever it is we're doing. Okay, these are just like carbs, basically is what that is, different types of saccharides. High fiber or low fiber. Some people, again, a lot of bacterial issues may benefit from low fiber for a while if they have a lot of imbalances or overgrowth. And I mean, like high overgrowth, not just, some overgrowth or some autoimmune stuff. If somebody comes in and they have really decently well-balanced bacteria, they got good, decent function, but they're not clearing very well. If they're pretty backed up or they're undernourished, or there's a lot of junk in the system, we could throw in a little bit more fiber and see how they do. And depending on what we want, some people we want soluble fiber. Some people we want more insoluble fiber. It depends on how much water we're trying to balance in the gut, how much weight they're carrying, have they lost a ton of weight, are they gaining weight? These things all matter, okay? Again, low carb versus high carb. Some people need more carbohydrates. If I'm doing a flush phase with somebody, so oftentimes you have to balance with bacteria, but it typically looks like a flush phase for a few weeks. I got to build up first. There's foods and supplements and lymphatic work and liver care. And sometimes we look at acupuncture and we change your water levels and all kinds of stuff to flush your system really nicely, okay? And so in these flush phases, typically I'll add extra carbs because those carbs are going to be beneficial for the liver to clear stuff out. Other people, again, might need a higher protein diet. Depends on what they're lacking. And so these are just some things to consider. I don't want to spend all day talking about each diet, but variable and mixed diets. Some people, we just need to balance it out and change the basics of what they're eating. But if you're already eating really good quality, organic, if you're eating nice food, you're home cooking, not eating frozen dinners and fast food, a variable mixed diet's probably not going to do it for you. Some people just eat really badly, and that's why their gut's a mess, right? So you just got to balance that out. So everyone's going to be different. There are medical foods, for example, that some people have no food tolerances. They completely inflame their gut so much so they can't eat other foods. They have to eat just basic elementals like an elemental diet. Not good for everyone. Sometimes very problematic, but for some it can be a good placement. Then we have probiotic, antibiotic foods. Some people are taking a lot of probiotics. We talked about probiotics and how adding them can actually be a problem. If we don't know what bacteria we have and what balances inside the body, if we're throwing in probiotic foods, lots of ferments and fermented vegetables, sauerkraut and kimchi and different types of yogurts and kefir and all kinds of stuff, we don't know what we're putting in. Taking probiotic supplements, we could be adding more to our imbalances without realizing. This is why we need to do testing and figure things out. Same with antibiotic. Which way are we going to swing? Okay, so we talked about some of these different ones, cleansing, detoxing, lymphatic. It depends on what phase we need. And so food is never as simple as here's a program, just take it and run with it. For some people it is, but it's typically pretty rare. If you're somebody who just eats a lot of really unhealthy, bad foods, you can do a lot of work just by cleaning up your diet. But if you've tried a lot of things, you've tried different diets, you've tried different drugs, you've been talking to doctors, you've been on this for years, you've not gotten help. It's been a big, big struggle. You're not finding answers. Things are staying the same or getting worse, or getting a little better, then getting worse again. then we need to dive deeper. It's not going to be that simple. Okay. Another one is liquid versus whole foods. What's the state of your gut? What are you digesting better? Some people, we need to push whole foods through because we need their body to work. Some people are so exhausted, we have to go liquid so that they can break things down, digest, and absorb easier. Everyone is going to be different. Okay. So Benjamin asked, how do we determine if lectins are an issue? That's a great question. You can honestly just wing it. Try a lectin diet, right? There are a lot of things that have lectins, and we have to be careful. Somebody might have histamine issues as well, which can respond similar like lectins. And so if we were to take, say, beans, a lot of canned things, canned beans, green beans, string beans, your haricots and kidney beans, all those things can typically be lower lectin after they're canned and cooked. But canning typically increases histamines. So we have different types of reactions. And so you can look at like a lectin diet. It's very restrictive and very difficult to do, but something worth trying. It's a relatively small percentage of people who deal with lectin issues. It's not that big of an issue. But if you've tried all the things and still aren't getting anywhere, it might be worth a go. Okay. So here are some foods we generally considered safe. So things that we want to look at, guys, are going to be your soft foods, your cooked foods. So soft foods might look like sweet potatoes, avocados, some salmon, things that like you could give to like a toddler or a baby that they can just mash up really easily, right? Smoothies, things like that. That's your easily digested. If they're soft, they're typically easily digested. Compare the texture, for example, of like a salmon or cod to a steak, right? Steak, especially well done, it's like leather, that's really tough to chew, really tough to digest. It's going to be a problem for you. And so easily digested foods are generally considered a good idea in general. Okay, so it might be, instead of steaks, maybe it's ground meats instead. Low FODMAP, again, generally considered safe. Most people do well with a low FODMAP diet. Again, it's going to help. But I want you guys to really understand this. It's not about what's the one thing I can do, because there's a lot more damage done. And I'll explain that here in a moment. I really want you to understand that. But other things, again, just low histamine and organic is typically pretty safe. Now, things like avocado, typically high histamine, spinach, high histamine, canned foods, canned fish like tuna, high histamine. And so generally, if we go these directions, it can help ease some of the symptoms off for a little bit. It's not going to fix the problem, but it might take away one of the contributing factors that are contributing to your issues. Okay, so something to consider there as well. So this is why, guys, I know today we wanted like many people probably came in going, I'm going to get a meal plan today. I can't do that. And here's why. Like we talked about a few different things. So there are a lot of complexities I'm going to explain and why things are connected the way they're connected. And this can help you make a better decision rather than me saying exactly what you should do, because that can be really dangerous as well. And there's way too many variable factors. Like we talked about up here, where was it? This is just scratching the surface of factors to consider. We'll get into more of these coming up here, but there's probably 20 different factors at minimum we have to consider before recommending a meal plan. And so it's never a quick fix or a quick solution. There's never a what's the one thing I can eat, the one thing I can take. And most people want that. And we can't give that to you. And if you've been trying one thing, a supplement, an herb, a this, a that, you're only taking one piece of the puzzle at a time. It could take you the next 20 years to maybe figure out something to balance it easily. And this is why we can't just say, here's a solution. It's just simply not that simple. It's like, how do I build a house? Well, go get some wood. Well, okay, we need blueprints. We need engineers, got to build a foundation, got to get somebody to build the foundation. There's people who specialize in that. Then you need framers. You got people who come in after it's framed. Then you got to put up all your plasters and your drywalls, and you got to put your brick on. You got to build your layers, put in your HVAC, put in your water, put in your plumbing, get the blueprints, get the designers, get the architect to sign off. Then you got to get it serviced, right? There are so many different things that go into it. It's not just here's some wood to build a house. And the same thing happens in our guts, which is why we're going over all these details today, so you guys can understand the different types of diets, the different types of foods, all these things that are included. Now, Vanessa did ask a question here, talking about easily digestible foods and fibers. If you're doing smoothies high in insoluble fibers, but they're blended, is that going to be easily digestible? Yes and no. It's definitely more digestible than swallowing a whole head of cabbage, right? So the smaller, more broken up it is, the better. But again, those fibers, they're still fibers. Even though they're more digestible, those fibers themselves could cause a problem, because your body, it's what they do with fibers. Fiber and carbs and starches are food for your microbes. And so if your microbes are hungry, and they're eating all these starches and you're feeding, or these fibers, and you're feeding the wrong microbes, you're going to balloon and feel a lot of trouble. This is why going high fiber or low fiber, we really have to test and figure things out. And so, yes, it's more easily digestible, but it's not really going to change too much in the way they react within the body, because the body's still going to react as it's going to react. It just might have one less layer to have to deal with everything kind of beating it up. Okay. So this is really the why I can't give you guys a meal plan today, just food for thought. I want you to understand this when it's more in depth. Too many complexities, no quick fixes. And here's the issue we run into, guys. Oftentimes, like we talked about, we're trying to build a house or your house is broken. We got holes in the walls. We got holes in the ceilings. The foundation is falling apart. We're like, I'm just going to buy a new carpet and patch it up. It doesn't work. It's not livable. And the entire time, it just keeps getting bombed and destroyed. Every day, there's something breaking it down. We'll all just put a plaster on that when we Band-Aid. Another stick of dynamite comes in, it blows it up. Like, I'll just patch that floor up. And we're forever chasing these symptoms, never really getting to the root issues. And that's what we want to do through this masterclass. Monday, first day, we're talking about, diagnostic and testing, going through and finding a lot of the root causes. Yesterday or Tuesday, we're talking about your contributing factors. There's 50 different things minimum to consider, when we're looking at the basics of contributing factors and hormones and health and wellness and assessments. Then we have to get into the other stuff as well. We talk about herbs and supplements and food and nutrition, and it's very, very layered. So I just want to move us away from this. What's the one thing I can take mentality? And so here are some things we consider when we're making a program for you guys that we can actually give you something for something more tangible. Vanessa, food for thought. I'm not sure if I said that, if you said that, but I like that. All right. So when we're talking about a program, this is just the things that I consider. So you guys know what you're looking at now when you're going to do your own stuff. Number one, lab reports. We have to see what your doctors have. Any kind of scopes, we want to take those in. We want to look at blood work, right? That's a big part of it. Any type of MRIs, any CT scans, any type of X-ray, any type of assessment. All those things are going to matter because they're going to show us more of a real picture of what is going on. But remember, guys, going in for a colonoscopy is not a be-all, end-all definitive. It just tells us what the current state of affairs is. Oh, we're currently inflamed. We currently have ulcers. We currently have inflammation in this area of the colon. Full stop. They don't tell us what to do. They don't tell us why it got there. They don't tell us how to fix it. They just go, well, it's there, so here's a drug. And like Dr. Rawls was talking about yesterday, drugs mask the symptoms, but your body is still sick. So again, you got holes in the walls. You just close your eyes. You're not seeing it. Well, it's still cold in the house. It's still raining. It's still getting moldy. We have to fix the problem, okay? So GI maps. And Louise asked a question, should we be getting a GI map done first? Sometimes, most of the time I recommend a GI map, but I don't want you guys waiting to get GI maps. Now, if you didn't see our GI maps the other day, Luis, they're not simple, right? A GI map isn't a really easy thing we can just kind of whip up and pull up out of the blue. A GI map is something that's very, very in depth, and to be able to read one takes a little bit. So I'm going to create a little slide in here. I'm going to show you guys. This is an example, like a single shot of a GI map that I pulled up, okay? This is a GI map from one of my clients. So the problem is we get this. What do we do with it? What on earth do we do with this GI map? And so we see all these different measurements, all these different bacteria. This is like one page of like 5. And so we see all kinds of imbalances. We can see there's autoimmune inflammatory. We can see all these things. People always ask me, well, just give me a GI map. Okay. Right? It's like saying to an engineer, well, give me the blueprint. I'm not an engineer. I'm not an architect. I'm not trained. I'm not a general contractor. I don't know the first thing about looking at a blueprint. So why? Right? And so definitely, I encourage people to get GI maps done, but I just don't want you guys going to Google and trying to take this down yourself because it can cause a lot of problems. Okay. So other things we can look at here, different types of assessments. Now, when we do our intakes, guys, there's things we want to consider. We have to look at your full medical history because like we talked about, when you're picking food and nutrition and diets, your full medical history does matter, right? This is why my intakes are about 30 different pages, give or take. Between GI mapping, my own assessments and everything we get in, it's about 30 pages of paperwork to take in. We do food journals and food logs. We want to see how your body's reacting. Because even though maybe your IgG tests or your food tests come up clear, and you guys have said, well, no, my IgG said I can have canned tuna. Well, I got a food log in from a fella I'm working with recently. He's got Crohn's, young kid, and he's eating canned tuna with oil. Well, he's getting moody every time he eats this canned tuna. Well, why? It's super high in histamine. He probably needs a low histamine diet. And so we can track and start to figure these things out. Okay. We got to go through your medical history as well. And then again, with the best guess, guys, 30 pages of paperwork is still going to be trial and error. So if you're in here trying to pick a meal plan, you haven't found one yet, and it's been a while, and you're still deciding between which diet you want to jump on and try, it's going to be trial and error. Even for us with our best education, right? This being a specialty, it's still a bit of trial and error. Now, Sandra asked, what about Acidophilus probiotic? Acidophilus is typically okay. Bifidobacterium, Lactobacillus, and Acidophilus particularly bifido and lacto are the ones we see most depleted in somebody dealing with GI issues, okay, like colitis specifically, but not everyone. I've got people coming in right now who actually have elevated levels. So acidophilus, it's still a bacterial strain. And so I want you guys to understand that without understanding and doing things like a GI map, if you came in and we tested your acidophilus bacteria and it came up super high and you're adding acidophilus probiotic, well, now you're contributing to the problem, right? And so it's very, very particular. This is why it's a what can I take? There's no one right answer. Okay. And so this is what it's like when someone says, I'm going to go ahead, I'm just going to build it, I'm just going to repair one thing at a time. Just so you guys know, for me, I want you guys to understand, because I need to hammer this in. If you guys are going to make better decisions and really learn to help yourselves or to get help or to work with someone, us or whoever, I need you to understand that we have to clear this understanding of things. Because when we're just focusing on trying to do one thing at a time, we're patching. This is what it looks like to me. Okay. So what's the one supplement I can take? What's the one thing? Someone comes over, for example, okay, you get someone, she's driving and she goes in the drive-thru and picks up a cup of coffee. Okay. And while she gets her cup of coffee, she decides she's going for a drive. She's driving to the library. Who cares where she's going? She hits a speed bump. Coffee spills everywhere. Big disaster. Very upset. Coffee's a big, big mess. And now she's looking at the floor. She's trying to figure out what's going on. Coffee's hot all over her laps. Coffee in her eyeballs. Clearly, she hits a tree. Okay. Now the car is destroyed. Absolute total wreck. And then she goes over to a mechanic and is like, hey, Mr. Mechanic, I ran my car into a tree. I spilled my coffee everywhere. And there's all this damage to the engine, the radio, the motor. Everything's completely destroyed. What can I do? And he says, well, here's what we need. We got to do 40 different things. It's going to be, $50,000 in damage. The car is basically a write-off. We can't fix it. She goes, well, if I just don't go through the drive-thru next time and sit and drink my coffee, will that fix my car? And to me, I know it's kind of a ludicrous analogy, but that's exactly what it is when someone comes to me and says, hey, can I just take a supplement and repair all these holes in my gut? There is so much more damage done than that. It's just not that easy. And so I want to explain this a little bit further and actually relate it to the body, not just a car and a cup of coffee. So here's the thing. When we go to the body, we have these issues in our digestive system, okay? So maybe something came in, like Dr. Rawls talked about yesterday. He had a fellow who came in and he had eaten deer meat, went hunting, venison. It was spoiled, didn't cook it well enough, and he got a severe infection that day or the day after. He got colitis. His blood and been dealing with it ever since. Some people, it's the flu that onsets it. Some people are slow growth. Some people, it progresses. They have other issues first. Maybe their stomach is having trouble or something else is going on they don't know in their livers or pancreas or whatever. Long and short, these issues in here cause other problems. You spilled the coffee. Now there's a big mess over here. Now your liver is really sluggish and slowed down from the inflammation and toxins in your gut. So maybe in that case, we need an antibiotic-based diet. Maybe not, right? We have to figure it out. This can cause hormonal issues, both for men and women. Your kidneys can get sluggish and slow down. Your pancreas can slow down and stop producing enzymes where we see depleted elastase or steatocrit from the liver and digestion and fat metabolism. We see these on a GI map. And so our diets that we choose vary accordingly. And so here's what happens. One organ system starts affecting the rest. Then the problem is, once we have one organ system affecting the rest, all those other organ systems that are slowed down start creating other problems. Now your liver starts creating anxiety. It feeds back into the gut, causing more issues. Now the upset stomach we're having, maybe we got a bacterial infection that's backed up. Now your pancreas is slowed down. Now your pancreas isn't producing enzymes. Now we get blood sugar issues. Now we get moodiness. Now we get hangry. Now we get poor digestion. And now we got blood sugar problems. And guess what? Well, we got bacteria feeding in. Your kidneys can't filter it out. They're really struggling. Well, now the kidneys are slow. And I know this is nuts, guys, but this is how it works. Now the kidneys are slowing down, and now we're not getting proper filtration. That's going to cause issues with the liver, which is causing issues in your skin and your hair and your bacteria. And now we're having hormonal issues, right? Big one we see, especially with women with GI issues, we see a lot of dark, thick, clotted blood, really bad PMS, a lot of menstrual cramping, breast tenderness, discomfort, a lot of things going wrong. With men, we see a lot of sexual dysfunction, erectile dysfunction. We'll see loss of libido, all these different things. And now here's the problem. When these other organ systems start to have their own issues, they start feeding other organ systems and causing issues. So now hormones are a whack. Now they're causing anxiety. Now that anxiety causes more gut disturbance. And now all this issue going in is causing more stress, for example. We have bacteria feeding back, causing anxiety with the hormones in the brain, which overstrain the adrenals. Now your adrenals are strained. It's causing more hormonal issues, which then affect your gut. And so guys, these things get so out of balance. One thing happens more and more and more, and all these other organs start having more issues. And as these issues start to pile up, guess what? those other issues and cries for help start signaling other systems in the body saying, hey, I'm having a problem. Someone fix me. Come and help me. We get more symptoms, and your symptoms start showing up even worse. And the problem is, guess what? Again, now those symptoms that are showing up are causing more issues in other organ systems. And now we've got this freaking pretzel. Nobody knows where it started. And now we're on 15 different medications. And I digress. And so we're picking a food, we're picking nutrition, and we're picking our supplement plans. Guys, please consider it gets very, very convoluted and very complex. Okay. And so we have a question here. Can libido happen for men and women, for both men and women? Absolutely. And so when there's any kind of sexual dysfunction, either vaginal dryness, periods are a mess. Like I said, a lot of PMS symptoms. If you're getting dark, thick clotted blood, breast tenderness, bloating, women who might be storing a lot of fat in the upper arms and the belly, and in men, we can see depletions in testosterone, elevations in over estrogen production. Those are typically what's happening. And this is all feedback from these convoluted systems. We see these sexual dysfunctions coming down, and that can be libido, it can be performance, it can be, again, not just maybe you have a dry, but there's vaginal dryness or erectile dysfunction. So all these things feed back. And now we have this convoluted pretzel of all these symptoms, and nobody knows where they're coming from or what's causing them. And now we got 15 different medications, and those are half of them are there to mask side effects from other medications and other things going on. And all the while, we should have treated this one issue. Now it's too late. We can't just go back to the drive-through, right, and just drink our cup of coffee, the car magically fixes itself. The car is already broken. And so now what we have to do is go back in and begin to fix everything piece by piece. The car is already broken. And so in order to go back to the basics and start reversing things to be able to go from here, we need a proper plan. And so picking your food plans and picking your supplement routines and picking your lifestyle stuff and getting GI maps and figuring out the stages. Typically GI mapping, some people need to flush. Then we got to take care of their liver. Then there's some lymphatic work. And then we have to do XYZ. And then there's supplements to balance this one, then this one. And it's a whole lot of things. And so what we need to do is go back in and create balance. And we have to unwind it. We can't just start back in the drive-through. The damage is already done. So what can we do? And so here's the thing, guys. We have this today. We need to balance all your systems. Otherwise, we're going to keep ending up in this one spot. And so food is a problem. Now, again, we talked about 15 different diet types. We talked about high FODMAP, low FODMAP, protein, carbs. We talked about some examples of where they are. But I promised you guys this week, we're going to make you guys an offer. One time, just for this masterclass, because you guys are here, because we love you, okay? And here's what we're going to be doing this week. And we'll get to some more questions after this. I want to make sure this gets out there as soon as possible so you guys can start figuring your stuff out ASAP. This is a one-time masterclass only, okay? Here's what we got for you guys. We're going to call it the masterclass special.